Welcome to Spotlight Gulf Coast, a weekly showcase of people and events across South Mississippi. Spotlight Gulf Coast is partnered with William Carey University and sponsored by the IP Casino Resort and Spa, Mississippi Power Company, Ray Brandt Auto Group, and the Butch Ostelet Foundation.
Hi everyone, this is Todd Trinchard, Executive Director of the Baco Foundation of South Mississippi, welcoming you to another segment of Spotlight Gulf Coast right here on WXXV. Each week we're talking about what's going on all across South Mississippi, and we want to thank our sponsors for this generous opportunity. Well, we've got back with us, came back for some more, Dr. Joseph Cox. And Dr. Cox, appreciate you coming on. I learned a lot last time you were on. We were talking about some of the new techniques of spinal surgery, and
that's right. Yeah.
Telling you about a good friend of mine that was just experiencing that. But I want to go into that, but let's bring everybody up to, speed as to where you did your practice, how long you've been here, and let's just get people to know you.
Yeah. I'm originally from Birmingham and did my medical training there. Made my way up to Ohio. Actually, my wife and I both met in medical school, and you'll get to meet her in a moment. So,
right.
We both did our residencies in Dayton, Ohio, where she was able to do a military residency, and I was able to do a civilian residency, and us work in the same hospital. So that was a really big opportunity and privilege for us to be able to do all of that. And so, once I finished there, moved down to Dallas, Texas, and did my spine fellowship at the Texas Back Institute. And then while I was doing that, Lynsey was here at Keesler Air Force Base. And so we really fell in love with it at that point, and fell in love with the people and the community and all the fun things that we had to do here. And so started planning routes. At this point, I've been in practice at Bienville for 5 years, almost to the day here. So 5-year anniversary. And I love it. And it's growing my family, growing my practice.
Right.
And just having a good time while I'm doing it.
I told you when we were coming on break, I saw right away that you're very interested in getting your name out there and getting yourself out there to, be the person people think about when they may have something that is hurting them, like their back. It seems like the older I get, the more my back seems to be going out. I'm sure that's a normal sort of...
ubiquitous may be too strong of a word, but it's extremely common to have back pain. Certainly as we go through life, we put a few more years on, it gets a little more common. And a lot of people are able to manage that back pain with conservative things, therapy. I like to say that you're building a brace on the inside. So therapy is important, keeping your body strong, your core strong, and all the other healthy things, not smoking, keeping a healthy weight.
Right.
But when those things aren't working, that's when it's time to come see me and have a serious discussion about, what the options could be for fixing that.
I know you were talking to me when we were talking about, what would you like to stress? And one of the things you were talking about, some of the things that you can do to live your best life, because you don't have to go through pain. Pain can be debilitating. It can affect every facet of life, where you sleep, your work performance.
Absolutely. So, pain makes your quality of life poor, makes it harder to do the things you need to do for your work, makes it harder to enjoy the things you want to do when you're not working. So, what I try to do, especially in those initial visits, again, with the conservative stuff, we want to do the thing that's going to get you back to that life the quickest. But as we move down the road and the conservative things aren't working and we start talking about surgery, part of my passion really and goals for each patient is to try and figure out what I can do for that patient that is the least amount damaging to their body. So in order to work on a spine, you really have to go through a lot of stuff. So how do we do that without damaging much tissue? And so there's been some really cool technology developed in the last 10 to 15 years, and it's gotten more and more accepted and more understood. And so we're able to do some pretty robust surgeries to help people feel better with a small incision, which means a small small amount of damage, which means less pain. And so people can get back to their life quicker, even after a relatively large surgery.
Now, one of the things that also impressed me is, I think we were talking on the last show, and I remember this, you're not only the youngest spinal surgeon here that we have in the region, but you've been recognized around the country with some pretty significant, award.
So yeah, I was named to the NAS 20 under 40. So it's a collection of 20 spine providers across the country that have been recognized for their contributions. And so, I think that I've had some really unique opportunities. Of course, it's almost seems like everybody knows at this point, but I was part of an amazing team that did the first spine surgery on a shark in the entire world. And so that was a really unique opportunity. I've been involved with some teaching of certain techniques. There's again, a relatively minimally invasive surgery that we do. And it's referred to as the prone transpsoas approach. So without going into too much detail, it sounds real simple, but it took decades for this to sort of be developed. But the patient lays on their stomach and we operate on the spine through the side and then from the back simultaneously. And it's a really, you can get a lot of goals for someone's spine accomplished for their spine pathology. And I've, again, been part of this team that is helping teach it to other surgeons across the country. So that's, some of these opportunities that I guess I've been a part of that, somebody thought high enough of that, I was named to that group of providers. So really a high honor.
Yeah, quite impressive. Now, I guess that the earlier you can detect things, the better results you're going to get. You don't want to let something get too far to where you start compensating and have other, I guess, things that start taking the place of really what the original problem was.
I think you're onto something there. You certainly are going to pick up stress on other parts of the body when you're compensating for pain or functional deficits in another part of the body. So there's probably, I would say, a happy medium. You don't want to fix things before they're a problem, really. But yeah, there is a point where it is very far gone, and it does make it a bit more complex to deal with. But again, I see a lot of those things, and I'm excited to take care of them.
Well, we're going to have you take a little break here. We're going to get your wife to come on. We're going to talk about another whole realm of medicine and what she's involved with. Then we're going to bring y'all back because y'all volunteered to walk the runway for us. So I'm very excited about that. I said, but we've never had two doctors, couples at the same time with Randy and Tracy Roth, and now you and your wife. So I'm very excited about that. So we're going to take a short commercial break. We're going to be right back after a word from our sponsors. Welcome back, everyone. Of course, we're joined by Amanda Ray. Amanda, appreciate you coming on, and Dr. Lynsey Cox, and real excited to hear about the field that you're in. I know nothing about, and so we were laughing about that before, but I know Amanda would certainly know a lot about, OBGYN. Gynecology, and I want to sort of pass it off to you because being a mother, you would know that, and y'all were sort of communicating a little better than I was because I'm shaking my head.
Well, I know I was so excited whenever I heard that Lynsey and Joe were coming on the show. The first time I heard Lynsey speak was What the Health. It was a couple years back, and I was like, oh my gosh, she's amazing. I'm very excited about her coming on. So tell us a little bit about your history, how you got involved with gynecology, how long you've been practicing, and then we'll talk more about wellness checkups and routine checkups and things like that.
Okay. Well, so gynecology means the study of women. So gyne means female. Okay. And so I've always been, kind of a girl's girl. And then when I went to medical school, you go through your different rotations because I was still undecided. I didn't know what I wanted to do. So I did general surgery, and I love general surgery, but I really preferred the female patients. And I did psychiatry, and I love psychiatry, but I liked my female patients. And then as I went like internal medicine, like everything, and then I finally did my OB/GYN rotation, I was like, this is where I'm meant to be. So, and I tell, medical students that when they're going through, because a lot of people, they know they like medicine, they know they like to help people, they know they like science, but it is hard. It's a hard decision to make, because there's such a broad option. But I went into that and have felt very, happy and at home ever since. I just like taking care of women. People ask me all the time, do you like your job? I'm like, I love my job. I have the best job, because I just get to talk to women all day, talk about things that, it's all aspects of life. So definitely the wellness, the cervical cancer screenings, the breast cancer screenings, all the things that we have to keep up to date. But also when you're just, going through a tough time, or you're, want to talk more about your relationship with your husband, or you're, going through something with your kids, or you have just different, all aspects of life.
Right.
So.
Well, tell us a little bit about wellness checkups, preventative care. I mean, I know as a female, something my mom told me at a very young age is always, have your yearly PAP, have your breast examination, make sure to take care of yourself.
Absolutely.
So tell us about that. Tell us, the ages, the ranges that women should come in yearly, whatever that is.
So I always recommend, so it kind of depends on, so there's two types of visits that I see, right? So I see the healthy, just the wellness, and then I also see the problem visits. Okay. So with the wellness, that really doesn't start until age 21, which is a change. So it used to be when you were 18, you started going to the OB/GYN every year. And then, to get your routine pap smear. Then they changed it to 21 because, anyways, they were basically over-treating. And what we've realized is that when women contract the HPV vaccine, a lot of times if we don't treat and we don't do anything, they're under 25, their body will just naturally clear it. And so it's kind of just a monitoring. So a lot of times when women are under 25, we do the pap smears, we watch, we see if your body just clears it. Now, when you're over 25, that's a different ballgame. So your immune system is not the same. You may not clear the virus. And so that's when we really have to monitor closely, make sure if you do have an abnormal pap smear, you're following up. So that's what I always tell women is, because it's, nobody wants to get an abnormal pap smear. But when you do, I'm like, if you keep following up with your gynecologist, we're not going to lose you. We're not going to, miss it. We're either, it's going to progress and we're going to treat you, or it's going to get better and, we'll just continue to monitor you. So the, and then, for the mammograms, those start at age 40 is when we start, traditional screening. Now, if you have a history of, a family history that's really significant, sometimes we start earlier. If you have a history of having a, genetic abnormality, like where you're, you carry a high-risk cancer gene, then we start screening earlier.
Okay. I know that, so I have a history of breast cancer on my dad's side. My grandmother died at a very young age. I mean, my dad was 18 years old when she passed away. I think she was 50 maybe. So they definitely, at 35, they had me start coming in to get mammograms, which is so important. And I just think so many people, especially busy moms, they don't take care of themselves, and it's so important. Exactly.
And that's what women do a lot of times. I mean, I laugh about this because I always say that our surgeries are probably canceled the most frequently.
Oh, yeah.
Our appointments are probably canceled the most frequently because they're like, oh, yeah, I forgot I've got to pick my, kid up. Or, well, so-and-so was sick today. So, so I mean, women classically do that. They're the caregivers of the family, and so they will, put themselves last.
I know, but we have to stay healthy and strong for our families and to take care of our babies and husbands and households. So
Absolutely.
Well, let's talk about October. We were just talking about that a few minutes ago. Breast cancer awareness. October, you get busy. So
yes, I always get very busy in October, which is great. The just the outpouring of support everywhere. I mean, you see it at football games, you see it in the NFL, you see it in the hospital systems, and usually there's really good deals at the imaging centers also, promoting mammograms and making sure that women have access to care, making sure that they have availability to get that annual mammogram.
That's great.
To catch these cancers really
early on. It's wonderful. Todd, would you like? Look, you're just listening.
I learn something every time, even when I'm listening. Believe it or not, but one of the things that I picked up, it is so. I would think. I think it would be very comforting to have a female physician if
yes.
you're coming to talk to them about, female issues. And
I've always preferred having a female. Now I know
30,
some
40
of our
years ago,
friends
that
go
probably
men.
wasn't the case. I'm
Yeah.
sure that that's really been a big shift.
Well, it has been a big shift, and we saw it in the residency programs too. So when I did my residency in Dayton, Ohio. Through the military, I was active duty at the time. So Wright-Patterson Air Force Base is up there, I did some of my stuff with them, but they also had Miami Valley Hospital and Boonshoff Medical School, which was the civilian huge practice, with the level 1 trauma center, the big NICU, like all that kind of stuff. Being up there, we had that shift of where, you had all of the residents who were mostly female, and then you had all the attendings were male. And so all of our teams looked like that, where you had the male attending and then the female residents. And it became, because traditionally in medicine, it was a predominantly male field, but then even by the time Joe and I graduated medical school, the incoming class, the year after we graduated, it was over 50% female.
Right.
And so it's been just a shift, not only in OBGYN, but in all aspects of medicine.
Right.
And I think that probably stopped a lot of women a long time ago from going to the doctor if they had an issue or something like that, thinking that,
Right.
I didn't want to either hear it from a guy or whatever. I mean,
Sure.
that's
There are a lot of women that have, that are more comfortable having a
Right.
female. I mean, I know lots of male OBGYNs who provide excellent care, and
Right.
And I learned from a ton of trained under a ton of men, and they are wonderful also. But I do, and I say this just from my personal experience. So I delivered babies for years before I had my own baby. Then I had a baby, and I was
Right.
like, wow, that was
Yes.
Let's talk
Something
about that. Let's talk
seeing
about that
someone
round ligament
that's
pain. Let's talk about exactly.
Yeah.
Well, time's gone real fast. We're going to get your husband to come on. We're going to talk a little bit about Renaissance for One Way.
Okay.
Because I know y'all both coming out and getting part of the community. Excited
Yes,
about
we're
that.
excited about it.
Appreciate Amanda you coming on this segment.
Thank you.
Helping me out a little bit.
No problem. We got
We're
it.
going to take a short commercial break. We'll be right back. Welcome back, everyone. And now that we've got both husband and wife together, I think I was telling y'all before we came on the show, this is the first time we've ever had a husband-wife doctor unit. And one of the first things that comes to my sort of mindset is there has to be some adjustments you make. Doctors are known to work incredibly long hours. Everybody, just thinks, oh, they're so lucky they're doctors. And no, there's a lot of work that goes in.
A lot of work.
To be a doctor and a lot of discipline. And I'm sure there's been some things that y'all have had to adjust. And I also want to talk about how y'all both had to probably agree that this was the place for you. Because, again, we're talking about just how unique this is. So let's start with that. What is it like being married to another doctor?
It's amazing.
That's
Must
the right
say it.
answer.
Yeah.
Must say it.
Yeah, so there have been points, of course, we went through residency together, and we didn't have kids at the time till the very end, but it was extremely busy then. It is far busier now, and we've tried to do it a couple of different ways, and I guess at one point we were both essentially working full-time, and it's not really doable.
No.
And so we did have that conversation of, how do we make this better for our lifestyle and, the things that we want to do, and be able to, make it through every day and be happy at the end of the day.
Right.
And so,
And that was when I decided to do the GYN only.
Yeah.
And so I don't practice obstetrics anymore. So the hours are a little bit better.
I know the physicians that I'm very close friends with, and I'll bring up Randy and Tracy Ross because I've known Randy for so long
They're lovely.
personally, and he does a lot of things quietly behind the scene. He may be the team doctor for Resurrection, but he's also seeing patients.
Absolutely.
For people that he can help out. But he's had some long talks with me also about sometimes he just needs that downtime. I mean, you've got to take that downtime. And if you don't put your family first, then it'll all unravel very quickly. So I know that's probably a great adjuster
For
how
sure.
we think.
Well, and that was kind of the thing, because there are absolutely, doctors that are married to each other that, both practice full time, but it's kind of whatever works for your family. And so for our family, I just wanted to be, at home more, a little bit more hands-on. The other, probably our secret weapon is my mother. And so when Lucy was 6 weeks old, we were still in residency. And so she actually moved to Ohio with us for my chief year. And when we would be, at the hospital, she would be at home, taking care of the baby. But I mean, there was one night where it was 9 o'clock. I was on my GYN oncology rotation, had just done a huge case, had just admitted the patient in the ICU. I called Joe and I was like, "Hey, how's the baby?" And he goes, "What?" He was like, "I'm at Children's. I'm at the hospital." And I was like, "What?" And so, then I had no idea he was still in the OR. He had no idea I was still in the OR. So I called Mom because, she didn't know. We were just kind of stuck in these cases. So I called Mom and she was like, "Oh, we're fine. I just put her to bed," But I'm like, what if we had her in a daycare or something? I mean, I'm sure they would have hunted us down, but still. But she has stayed with us since then. And then we had our second baby 5 years ago. And so she just helps us. She kind of fills in those pieces where, where they need a parent or we need somebody to be picked up or dropped off or taken to school or, she's the secret weapon.
Yeah.
that keeps our life, going. So
Now, y'all both sort of just jumped up and want to be models, or did y'all have a discussion about this?
I really did.
Huh?
So, yeah.
So
Who had to convince who?
Well, I always say, when you like plant a seed, and so we've been, because Bienville's been supporting the Renaissance Runway for years,
Right.
and so we usually try to go, and we like to go to community events, and so we had been approached, in the past, and so it was kind of, they plant the seed, y'all should do it, you should do it, and so then when it came this year, I was like, let's just do it. And so I called Joe, I was like, I'm only doing it if you do it. I don't want to walk out there by myself, so walk out there on stage with him. But he was like, yeah, let's do it. So I think it's gonna be a really fun event.
Yeah.
Well,
I'm
we've always
excited
had
about
such a close relationship with Bienville. In fact, I was at the ribbon cutting when it first opened up at the new location, and we were presented a check by Bienville as the one nonprofit they wanted to support.
Oh, that's awesome.
Of course, we had Dr. Drake living across the street and Jeff right down the block, so we knew a lot of the physicians. But today, Bienville's gotten much larger, and I know that's been expansion. And then you working with the Ochsner Health System, and of course, Ochsner's worldwide name, and
yes, they provide excellent care. It's nice to have our clinic, because we're kind of a satellite, outside of New Orleans, and then they've also bought Hancock, and so we can do procedures and surgeries and that kind of stuff over there also. But it's nice to have such a strong backing of subspecialists, so like urogynecologists and GYN oncologists and all that kind of stuff. So
well, y'all gonna have fun doing this fashion show. This is not your normal fashion show. Have fun, get out there, and there's no telling where it goes once we get this thing going. But that's what it's all about. But it's for a great cause too. We're raising money for scholarships. I think this whole Barbie idea of the pink golf carts and the, that's going to really be fun. To see that, and you get to meet people. I mean, you get to meet other people in your community. Jonah, you were talking about how you wanted to get your name out there, how you wanted to get out in front of more people, and
So I think that's another reason of doing it. I think you sort of put your pride aside, maybe. That might be a problem for a lot of people, and I think it's a great cause, and it'll help me, meet those people like you were saying, and hopefully just a little bit of name and face recognition. But hopefully I can help those people if and when they need it.
So I can promise you I'll have to grab the mic, and because we'll have a bunch of doctors in the crowd, and I'll make sure that, hey, this may be their year, but y'all need to step up, and, because like you said, a lot of them like, no way.
Well, I think it's, for everybody. Getting up on stage isn't like, I guess, everybody's go-to way of having fun.
Well,
but I think it's going to be great.
we do not take ourselves too seriously.
Yeah.
So.
Well, I appreciate y'all coming on, and I appreciate all the information that I've learned from you, and certainly
Thanks
from
for having us,
listening
Todd.
to you and Amanda. That's one thing that this show provides. It gives just a little bit of information each week, and you start putting it all together, and you realize why you live here.
Oh,
I
absolutely.
mean, this is just such a great community that, you know, you can do this, now go back to your place of work and appreciate what y'all do. Thank y'all.
Yes,
Thank you,
thank
Todd.
you.
We appreciate everybody's support of the Baco Foundation of South Mississippi. And until next time, this is Todd Richard saying so long, and may God bless.